nausea in pregnancy, the causes, the remedies, treatment.
Now, nausea in pregnancy, it's one of the commonest symptoms in pregnancy. It bothers women. It's very irritating.
Oh yes.
It makes everything not work.
Yeah.
Because when you have nausea, you don't want to eat. Your
body's just tired.
You don't take water. Your body's just tired. You get headaches.
Everything irritates you.
Everything irritates you, including your man.
Yeah. Hello and welcome back. Another episode, another time, Ask Your Gyno series. This is us. I'm your host, Faith Ngami. And in studio, we have Daktari, as always, anawapenda. And he's here. Karibu, Daktari.
Asante. Thank you so much. Nawapenda sana my fans. Dr. Karanja here, your consultant gynecologist. And I'm always ready to answer to your questions. And I'll give the answers to the best of my knowledge. So, Faith, thanks for having me.
Karibu sana.
Asante.
TikTok wamekupenda.
Nawapenda pia.
Mumependwa. Umeona amewapenda. And that is why he's back on studio. Na atajibu. Leo maswali yenu ya TikTok. Tuko na yeye.
Ready for it.
Hapa. Tungeingia live, mungetuma zingine. Na atajibu.
Yes.
So, Daktari, without further ado, we have the abnormal spotting in a young lady. What is normal and what is abnormal?
We usually say there's no normal spotting.
Yes.
Until the doctor tells you it's normal.
Yeah.
Yes. So if you're not having your periods, in between your periods, you're not supposed to spot. But once in a while, there are women during ovulation.
Okay.
They do spot. Infections also commonly cause spotting. You might have a discharge that comes with some spotting.
Yeah.
There are women who use hormonal pills or hormonal drugs.
Yes.
Because that one can change their hormonal balance. So they get spotting. But your spotting, for you to say it's normal, it should not be persistent.
Oh, yeah.
That every cycle it's happening, and there are other associated symptoms that you might get. If you get a spotting with a discharge, spotting with cramps, that is not normal.
Okay.
Another common cause of spotting is if someone has stress. And by stress, I don't just mean the physical stress.
Yeah.
Like change of weather, you're traveling from Mombasa to Nairobi. Maybe you've lost someone close, or you've lost a job.
Yeah.
Or you were exercising and suddenly you stop. That one can cause hormonal imbalance. Which one of the symptoms can be spotting. But it should not persist. So you need to see your
gyno.
Your doctor. And your gyno is here.
Your gyno is here. Yuko tayari. Anapatikana.
The other common cause, you see the lower part of the reproductive system.
Yes.
We have the cervix, we have the vagina, sometimes also the uterus. It can cause spotting if you have maybe a lesion or a wound or a growth.
Oh, yeah.
So you can imagine you're told spotting is normal, and yet something is growing.
Oh, yes.
In the reproductive system.
That's
yes.
True.
So you need to visit your doctor. So it's not normal.
It's not normal.
Until it's normal.
Oh, yeah. Until the doctor says so. It's not normal.
Yes.
And what about where we have at times, I think when someone is overwhelmed, either they're excited, spotting happens too.
It can happen.
So you're
like anything that can alter your hormones.
Yeah.
Can alter your cycle. Yes.
Okay. It's not normal until it's normal. Until the doctor says so.
Until the doctor says so.
Yeah. So the second one, they have like about 3 questions that are closely entwined.
Yes.
And they are mostly about the periods in terms of long-term, I'll say like long-term loss of periods, if I can, for lack of a better word. Yeah, they're missing their period. So there's one who's not seen their period for about 4 months.
Okay.
Then there's another one who periods ilipotea for 6 months. Then after akaenda kwa daktari akapatiwa pills, zikakuja. Then once they were done with the pills, zikapotea pia.
Zikapotea tena.
Na ananiambia mind you, I'm 24.
Yes, very young.
Very young.
They should be getting regular.
Then we still have a third one who hasn't seen their period since they gave birth in 2007. The son is now 18 years old. Hajawahi on a period.
18 years.
For 18 years.
Quite long.
That is very long.
Now, we need to differentiate two things.
Okay.
And also that might tell you what might be the cause of missing the periods.
Yes.
There are those who have what we call primary amenorrhea. Meaning they've never had their periods. Never. Even from the time they were 13, 14, 15 years.
It does happen?
Yes.
Okay.
Now, whatever you're quoting there is what we call secondary amenorrhea.
Okay.
Meaning you've had your periods before, then either you miss them for long or they delay.
Yes.
Yeah, so you can miss for 3 months, for 6 months, or completely. Now, and each of them has different causes. So if you miss your periods later, meaning you had your periods normal and later now you're not getting your periods or they're not balanced as you want it to be, most probably it's an issue of hormones.
Oh, yeah. Okay.
Yes. Now, after delivery, let me start from the third case.
Yes.
After delivery, most women, when they are breastfeeding, they will not get their periods 3 months, 6 months, sometimes even a year. So long as they are consistently breastfeeding.
Okay.
Yes. Majority after breastfeeding, their periods come. Now, if you take another 1 year without getting your periods, then that should be a concern.
Okay.
So she needs to see
the
gynecologist.
Yeah.
It could be a problem of the hormones, or it could be a problem of maybe the cervix or the uterus, or the ovary, because the ovary is the one that produces the hormones that control the cycle. Yes. So it's not normal to miss your periods for 18
good years. Yeah.
Because if you miss your period for 18 years, it means even conceiving.
Yeah, you are not. That's true.
You're not ovulating.
Yeah.
Yes. Now, the other one was she missed for sometimes 3 months.
Yeah.
Sometimes 6 months. Now, for that one, most probably it could be PCOS. We've had that discussion.
Yes.
What we call polycystic ovarian syndrome. But there are other causes that can do that.
Okay.
Is she on any hormonal treatment? Is she taking hormonal family planning drugs? Because there are some hormones which when you take, they make you miss your periods.
Yeah.
Sometimes even a year. Like, the implant?
Yes,
the implant that you put for 3 years. There are some women for the 3 years they are using the implant, they don't get their periods. It doesn't mean they are hidden somewhere inside.
Yeah.
It just means that they are not forming.
Yeah.
Yes, because of the hormonal changes. So she should also come.
Yeah.
We usually do 2 basic tests. One, we do a scan.
Okay.
An ultrasound scan.
Yeah.
That is, you check the uterus, the ovary, all the organs of the reproductive system. Then number 2, we take a blood sample. We check for your hormones.
Yeah.
And the hormones are they're like 5 hormones we test.
Oh, okay.
To see which one has a problem.
Yeah.
It could be all of them. It could be 1, it could be 2, or it could be 3. Yes.
Very important.
Very important.
I didn't know actually we had the test can check. We have 5 different hormones that need to be checked.
There are 5 different hormones that control your periods.
Yeah.
That's why any stress level that you have can affect 1 or 2.
Yeah.
And that leads to irregular periods or missing your periods.
Oh, yes.
Or prolonging your periods. Yes. So it's very possible.
Mnaona uzuri wa kukana gynecologist. Hiyo okay, mimi sikujua, sijui kama wewe ulijua. I doubt it.
Information is power.
Information is power. That is so true. Asante sana daktari kwa hiyo.
Asante.
Then, can I stop ovulating when I'm young?
Yes. Again, ovulation and periods are related.
Yes.
It's all about hormones. Because ovulation is controlled by, let me go back to the basics.
Yeah.
First, we have hormones which are produced from the brain.
Yes.
Let me not go into the details of the names and the science. Now, those hormones produced in the brain, they're transported to the ovary.
Yeah.
And they stimulate the ovary to produce now the hormones that control your ovulation, your menstrual cycle, and getting the monthly periods.
Yes.
That is why when you have stress, because stress is where?
in the mind.
In the brain,
yeah.
in the mind. Now, when you have stress in the mind, it affects the functioning of the brain.
Yes, that's true.
The hormones that are produced in the brain, when they dysfunction, they don't control the ovary well. If you don't control the ovary well, there is a problem with producing the hormones, which leads to instability of your period.
Hormones and the period.
Yes. So it can happen. Yes.
Kwa hivyo akutembele tembelea daktari atakueleza zaidi. Hii ni kionjo tu, but at least you know what is happening, so kindly plan a visit to your doctor. Ako Moi Avenue, Jubilee Arcade, Jubilee Building, first floor, Modern Gyno. Utampata.
Yes.
Always ready for clients like you.
Karibuni.
Tukiendelea, then what causes recurring miscarriages? Because anasema,
yes.
I was diagnosed with cervical incompetence and a cervical sacrilege was done, but I miscarried a week after, but the stitches were intact.
Okay. Now for that one, I'll need more history.
Yeah.
Because recurrent miscarriages, because that was the first question. What causes recurrent miscarriages?
Yeah.
We have what we call congenital problems, or genetic problems, whereby when the sperm and the ova fertilize during cell division, when the cells are dividing very early in pregnancy, it doesn't go the normal way. So you have an abnormal embryo.
Yeah. Wow.
So that leads to a miscarriage. If the same happens in the next pregnancy, it leads to another miscarriage.
What?
And that is common for the loss of pregnancy in the first trimester. That is the genetic and the chromosomal.
Yeah.
Now, if your pregnancy losses, you have recurrent pregnancy losses in the second trimester, that is when now the cervix comes in.
Oh.
Yes. You know the cervix? The cervix is ile mlango ya...
pali atatokea.
Yes, that is the cervix. Now, the cervix is supposed to be tight during pregnancy. It holds
the baby. Yes.
Or the pregnancy intact. Now, if this cervix has a problem or it's weak, what we call cervical incompetence, the inner part will start to open during pregnancy. And then you lose the pregnancy. So what usually happens when you reach around 3 months, we usually come and put a stitch on the cervix.
Yeah.
That stitch is supposed to hold the pregnancy until 9 months. Yes.
Okay.
Then it will be removed before you go into labor.
Okay.
Now, if her stitch was put and she still lost the pregnancy, could there be another cause? So she needs to discuss with her doctor to see is there another cause that might cause the pregnancy to come out?
Yes.
Or was the stitch put late when already the factors were already beyond repair?
Yeah.
So there are other things that will be checked to confirm if actually is it the cervix that is the problem. Because majority of women, once you put the stitch, and if the cervix was the problem, the pregnancy will last. Yes.
Because she has said this was the third loss.
Yes, the third loss. Quite unfortunate.
Yeah, and the stitches were intact for the knee. So two things: either it happened probably within the first trimester.
Maybe.
Because if it's in the second trimester, then that means the baby should have been intact.
The stitch should be able to hold.
Yeah, to hold.
But there are those rare cases that you even put a stitch. They carry the pregnancy, they reach like 5 months.
Yeah.
They get pain and the pregnancy comes out. It has happened before. So usually in the next pregnancy, you take more, there are more measures we take.
Yeah.
Apart from the stitch, there are more drugs we give and there are more tests we do to see if there's another cause that might have led to that. It's quite unfortunate and we're sorry for losing the 3 pregnancies. Yes.
Yeah. Pole sana, but again, the daktari ako hapa and he ameelezea, but for further details, you can visit him. He will give you further information on it.
Sure.
Then we also have one, and nimetumia depo once and some drops of blood are coming almost every day.
Depo is the injection.
Yeah.
Yes. Now, again, to our previous discussion.
Yeah.
Depo is a hormone.
Yeah.
It's a hormone that women it's a family planning method.
Okay.
That you inject every 3 months.
Yeah.
Then we have the implant, the one you put either for 3 years or for 5 years. Now, when you're given Depo, the reason why you don't get pregnant is because you're trying to stop ovulation from occurring.
Yeah.
Now, when you stop ovulation, it alters the hormones.
Yes.
And if you alter the hormones, it can do several things. One, you can miss your periods completely, or you can get frequent, irregular, prolonged bleeding. Or what can happen is this: you have spotting almost every day. And you do all the tests. You do a scan, you do screening for cancer, you do hormonal tests. It's normal. Yeah. So it means the problem is what?
Yeah.
The Depo.
The Depo.
And we have treatment for it. There's some drugs you can be given.
Okay.
To control the bleeding. Sometimes we might have to give you the pills to balance
the hormones.
Yeah. If that doesn't work, for some people the bleeding is too much, and now you even tell them not to use the Depo. Now you have to change the family planning method
to something else.
Yes, to something else, because bleeding every day.
Yeah,
you don't want
imagine.
That.
Yeah, yes. I mean it drains kabisa.
Yes.
So
there is treatment for it.
Yeah. Visit your gyno. Ask him. He will let you know more. Again, ask your gyno. Yeah. So I have itchiness during the action. I believe it's intimacy and no other symptom at all. It's just itchiness that has been there for a while.
Okay. Now, it's only during intimacy?
Yeah, during intimacy.
There are several causes that can cause itchiness, either during or even after.
Oh, yes. Okay.
And first of all, you have to rule out an infection. The other thing I'll want to know, is there enough lubrication before the action?
Yeah.
Because if there's dryness, of course, there's friction and you might get that itchiness.
Itchiness, true.
Yes. Some people have some skin conditions and they're very sensitive. So anything that touches on their private parts, they can get the itchiness.
That's
and some it's so severe, they itch and they even have skin changes around the lips. Yes. So if we get more information from that, you can try and get what could be causing the
itchiness.
Problem. The other thing we need to know is that do they use any gel or any lubricants?
That's true.
Yes. Because we usually advise just use water-based lubricants.
Yeah.
Then when you're washing that area on the lips, you're supposed to use fresh water and unscented soap if possible. Okay? You know there are many Ushindi. Let's not mention brands. But yes, it can happen. It's a concern.
Yeah.
And it's happened for long. Once or twice,
true.
that could be okay. But if it's persisting, she needs to come we check what could be the problem.
Because
and it's treatable.
It's purely just during that time.
Yes, and it's treatable.
Sawa. Umesikia?
And there are some who react to the reason why you need that them to come and ask many questions.
Yeah.
The women, they're sensitive they're allergic to latex.
Okay.
Like, the condom?
Yes.
The latex bit. Yes. They react to it every time they have sex and their partner is using a condom. That could also be another reason. We can't ask...
Hatuwezi uliza zaidi ya hapo. That is hiyo atakuja kuelezea mwenyewe. Tembelea daktari. He is so ready for you.
Yes.
Tembelea daktari. Atakujibu zaidi. Sure. But also, you need to rule out a few things. So kindly ask your gyno. Umemuuliza, amekujibu. Zaidi ya hapo, utampata.
Tuonane
kando. Sasa saisi nyuma ya tent, ndani ya ofisi.
Sure.
Then, kuna wengine nasema, I have a problem like I was told in the hospital that I have some fluid in my uterus. Nimemeza dawa na sahi I'm still in pain.
Okay, fluid in the uterus.
Yes.
I hope they're not confusing. There's what you call fluid in the uterus, and there's fluid behind the uterus. Each of them has different causes.
Yeah.
Now, having fluid in the uterus sometimes can be normal.
Okay.
You know, when you're having your periods, where does the period come from? It comes from the uterus.
Yes.
So you can do a scan during your periods or just after your periods, and they see fluid in the uterus.
Yeah.
That could be normal. It could be the blood that is coming out.
Yes.
The other thing that can be in the uterus could be an infection. So when you have an infection of the womb or the uterus, that fluid that comes out due to inflammation, so it can signal an infection. And for some, it can even be pus. Yes, USA.
Yeah.
So the infection is too severe and you have pus within the uterus.
Yeah.
So we usually relate the fluid that has been seen in the uterus and any other symptoms that you have. Do you have a discharge? Does it have a smell?
Yeah.
Is it spotting? Is there blood? Are you on any treatment? So sometimes it can be normal. Sometimes there could be a problem. Now, if you've received treatment and you're not responding, then you need to go back and recheck what could be the problem.
Yeah.
Yes. Another rare cause, although sometimes it's common in our setup right now. Now, if you see there's the uterus, that is the womb, then you have the cervix. Now, if you have a growth on the cervix, it will block the cervix. So whatever fluid that is produced in the uterus does not come out.
So inabaki tu.
Inabaki.
Yeah.
After periods, when the periods come, a little come out, then some of it.
Inabaki.
Yes. So you could actually be having a growth in the uterus or in the cervix or in the vagina. Yes.
So the causes are plenty.
There are plenty. Yeah. So you not only do a scan. Scan is not the only test you do. Even an examination of the reproductive system. The doctor looks at the cervix and the vagina to see if there's any problem.
Yeah.
Yes.
Akutembele.
Anaweza saidika.
Kusaidika atasaidika.
Yes.
Ni akutembele tu.
Yes.
Daktari amesema kusaidika utasaidika. It is not hujaachwa.
Sure.
Utasaidika. Then can warts be treated?
Yes, warts can be treated.
Okay.
Yes.
They're treatable.
They're different. When she's asking warts and she's asking a gynecologist, I believe there are warts in the genital, system. Yes. They can be treated and there are different ways of treating. There are drugs that you apply over where the wart is.
Yeah.
Or if they are widespread and severe, you can actually do what we call laser treatment.
Yeah.
It's like you burn them, the warts.
Yes.
But in terms of what causes the warts, they're caused by HPV. Now, HPV virus, it is your own body that will fight the HPV virus. There's no drug for treating the HPV virus. It's like all viruses, homa, mafua.
That's true.
Unaambiwa kunywa ndimu, nini, issue ya HIV. You're just given drugs to suppress. So most viruses, they don't have treatment. Your body, your immune system fights the HPV. Yes. But the wart itself, the lesion, yes, they're treatable. It
can be treated. It can be treated, girl. It can be treated. Shikilia hapo. And maybe you are probably a spouse asking for your spouse. It can still be treated.
It can be treated, yes.
Yeah. But you can visit your gyno for further details. Then we have nausea in pregnancy, the causes, the remedies, treatment.
Now, nausea in pregnancy, it's one of the commonest symptoms in pregnancy. It bothers women. It's very irritating.
Oh yes.
It makes everything not work.
Yeah.
Because when you have nausea, you don't want to eat. You
Your body is just tired.
You don't take water. Your body is just tired. You get headaches.
Everything irritates you.
Everything irritates you, including your man.
Yeah.
Now, it's mainly the hormonal changes that occur during pregnancy. It's not that you have a problem or a disease.
Yeah.
It's the hormonal changes that occur during pregnancy, and different people react differently.
Okay.
There are those with mild symptoms, so they just get little nausea, especially in the morning.
Yeah.
But as the day goes by, they're very okay. There are some who get very severe, they get nauseated and they vomit everything.
Yeah.
Smell, perfume, any food that is cooked, spicy foods. Some will even hate some foods. They don't want to see that food or even eat. Now, in terms of treatment, before we give you any drugs, there are some things we advise.
Yes.
You can take small, frequent meals.
Yeah.
Rather than having one large ugali, which we are used to. Take small, frequent meals.
Yeah.
If possible, you can have some dry foods. We advise more on vegetables and fruits.
Okay.
Again, try to avoid sugary foods and most of carbohydrates.
Yeah.
Because that one usually worsens the symptoms. Okay. Now, if the worst come to worst, like you get vomiting and you cannot retain anything, that's when now we give you drugs. So drugs should be the last option. But you'll find there are many women, you try the lifestyle changes and it doesn't work. So you have to bring in now the drugs. But majority, by the time the first trimester comes to an end, they're good to go. But there are a few who are very unlucky. Until 9 months.
Well, that is unlucky.
Very unlucky. So we have to remind them lifestyle changes and drugs, and because you also don't want to use a lot of drugs during pregnancy.
That's true.
Yes, because the baby is still growing. First trimester is very sensitive. So we have to balance between the symptoms and the drugs. Because if the symptoms are severe and you're not eating, that is bad for the baby.
That's true.
If you use a lot of drugs, again,
it's still bad
for the baby. So we have to weigh which one is the lesser evil.
Yeah.
Yes.
And no, for the drugs, to probably curb the nausea, how long do they take? The entire trimester or just maybe a week, 2 weeks, a month?
We usually give it in phases.
Okay.
You can give for like 5 days to 1 week. Then we stop and we see. We don't want to give you drugs, prescribe drug for vomiting for the whole of first trimester.
Yeah.
Even the pharmacies will not dispense.
Yeah.
So we give like 5 days to 1 week. Then we observe.
Yeah.
Then if they get worse, then we give you for another 5 days. So it's in phases.
It's in phases.
Yes.
That's okay. That's good.
Hatutaki uzoe madawa.
Kabisa. Mtoto atatoka na zoea madawa.
Utakuwa unasikia nausea kidogo tu unakimbia chemist.
Nipatie ile dawa.
Ile dawa ya Dr. Karanja.
Daktari ndo aliniambia nikunywe.
So we avoid a lot of drugs in pregnancy.
Thank you so much for shedding light on the nausea part, because it's something that so many people are going through it.
Very common.
And watu wanakataa kukula. Watu hawataki chakula, hawataki. And it's something that can be treated, imagine.
Wanasema ni mtoto amekataa.
Ni mtoto amekataa. Mtoto wangu amekataa hiyo. Ugali hapana.
Anataka Black Forest.
Na hiyo ndo umetuambia cut sugar.
Cut sugars.
So nausea can be helped. It can be treated. It can be, the causes ndo hiyo umeambiwa, bora ni mimba. Iko tu itakuja. But the remedies or the treatment, I've asked your gyno, he's shed some light on it. But for further information, anapatikana. Namba ziko hapa. Our contacts are here. Anapatikana. So, daktari,
yes,
kuna ingine hapa. Amesema talk about subchorionic hemorrhage.
Yeah, and you've pronounced it well. Subchorionic hemorrhage.
Shed some light on that.
Okay. Subchorionic hemorrhage is a medical term, but I'll try to simplify it.
Okay.
Now, you see, when the pregnancy, when you fertilize the egg, that pregnancy come and implants on the uterus. That is the uterus. So the pregnancy implants here.
Yes.
So you have like two surfaces that have come together. So subchorionic hemorrhage is like bleeding between the two
surfaces.
Yes, between the two surfaces. So if you have bleeding there, it means there is a weakness between these two. So if the bleeding continues, there will be detachment of the pregnancy and you can lose the pregnancy. So when you have subchronic bleed, it's still it's like a clot within that.
The surface.
Yes, that is joining the two. So the main issue usually is, most of the time it clears on its own. But sometimes you can have bleeding and the doctor will tell you to rest, like bed rest.
Okay.
Uko tu umetulia. Number 2, no sex. Because you know sex is action.
Yeah.
And when there's action and there's bleeding, you'll make it severe.
Yes.
You might be told you don't lift heavy weights, you don't exercise at that time, until when the scan now will show the bleeding has subsided or has cleared. Yes. So it's bleeding between
the
uterus and the baby that is supposed to implant that surface over there. Yes.
Does it happen in the first trimester, second? It occurs
most
at
of
any
the time?
time?
90% of the time, the first trimester.
First trimester.
Yes.
It's very, very crucial time.
Very crucial. Because that is when everything is forming.
Yes.
Yes.
What happens now with those people who don't visit the gyno? They're not sure if they're pregnant or not, and they don't visit the gyno, and these things are happening, and they have absolutely no idea.
No idea. That's why you have pregnancy complications.
Yeah. Someone
will tell you, I lost my pregnancy, I had not started clinic. So we shall advise, the moment you get pregnant, you go see your gynecologist.
Yeah.
Or for the very least, you visit the clinic. Yes. Because sometimes you can have that bleed and you don't bleed from the... So there's no symptom.
Umeona okay.
Bleeding in there.
Yeah.
Umeona tu kwa scan. When you do the first scan, now you see that bleeding. Yes.
So now that blood, it's usually inakuwa to retained hapo within the uterus.
Retained, then it will dissolve on its own with time. But there are some, because when there's that bleeding, it means there was a problem there. There was a weakness there. So that bleeding sometimes can continue. And now the whole thing detaches and you lose the pregnancy. Yes.
Pregnancy is it's one thing that is very...
Yes, it's a journey.
It's a journey, actually.
Lakini kwa muda. 9 months. Yes.
Hey, lakini hiyo 9 months inaweza kuwa refu.
It can be...
Yeah.
It can be long.
But thank you for shedding light. I really needed that light.
Thank you.
I have seen the light on it. Then, kuna mmoja pia amesema, kindly talk about a blighted ovum. And there was a question pia mwingine aliuliza, I miscarried, then I was told they had a blighted ovum. So what is a blighted ovum? I think huyu hakuelezewa zaidi about the blighted ovum.
Now, blighted ovum, there are some things in medicine that we don't know the particular cause. And sometimes when you don't know the cause, you also don't know the treatment.
That's true.
It's good to be sincere.
Yeah.
Now, you see a blighted ovum, the problem usually is in the fertilization.
Okay.
When you have the sperm and the ovum, when they fertilize, there's a problem in the cell division, what we call chromosomal problems. So when the cells start dividing, they don't form an embryo. And the embryo is the baby.
Yes.
So you're pregnant, your pregnancy test is positive, but when you do a scan, whatever is seen is just a sac, and there's no embryo inside. There's no baby inside. That is what a blighted ovum is. So that pregnancy will not progress up to 9 months.
Yeah, because there's no baby.
There's no baby. So majority, if nothing is done, nature will take its course. After around a few weeks, the pregnancy will start to shed off.
Yeah.
The hormones will come down. Even if you had the symptoms now of pregnancy, now they go off completely and you're in the first trimester. If you had nausea, the nausea stops.
It disappears.
Then when the hormones come down, now the pregnancy, you start bleeding and the pregnancy comes out. But what we usually advise, because that bleeding is unpredictable.
Yeah.
You can bleed for like 2 weeks, sometimes for a month. And if you have some things remaining in the uterus, you might get an infection.
Yeah.
So we shall advise you come. There are some drugs we can give to be able to flush out the pregnancy, the abnormal pregnancy. If the drugs don't work, now we do what we call evacuation. Ile wamama wanasema amesafishwa. Yes. That is what we do to remove everything from the uterus.
Yeah.
Yes. So that you can prepare for the next
baby
pregnancy. Now, in terms of treatment, because we don't know what causes a blighted ovum, currently there is no treatment or prevention, or a drug will give you and tell you when you take this drug, the blighted ovum will not occur, will stop. No. And you cannot predict who will get a blighted ovum and who won't.
Yeah.
Yes. So we let nature take its course. But the most important thing before pregnancy, 2 to 3 months before pregnancy, you're supposed to take folic acid.
Yes.
You remember?
Yes.
Folic acid is very important before you get pregnant,
and after,
when you conceive, and during pregnancy. Otherwise, there's no other drug that can prevent a blighted ovum.
Oh yeah.
Yes.
And it can be recurring because again, you do not know who.
Yes.
Nani anaweza kuwa nayo, nani anaweza kosa.
Yes. And when you get a blighted ovum, it's not a must that it will come again.
Oh yeah.
It's not predictable. Who will get it and who will not get it. Yes.
Thank you for sharing.
So we give you drugs.
Okay.
And we also
pray. Shikilia maombi.
Maombi pia inasaidia.
Kabisa.
Yes.
I do not know about you, but I've learned medical terms. Ile daktari ile umeniambia, that one.
Uko sawa.
Chorionic. Some chorionic hemorrhage and many other terms. And we are so grateful that Daktari, asante sana.
Karibu sana.
For taking your time.
Karibu sana.
To talk to us.
Yes.
And even to your people out there.
Yes.
Because maswali ni mengi. And they are constantly asking. Yes. Because again, si kila mtu anapitia the same thing. So mnakaribishwa, maswali yenu yazidi kuingia. Daktari is here. Ukiona it's too private, unaweza kumtembelea Jubilee Building, Moi Avenue, Mombasa. Our guests in Nairobi, tutawafikia tu.
Sure.
It was a lovely time with Daktari. Asante sana.
Asanteni sana, mnakaribishwa. We are in Mombasa, Modern Gyno Clinic, Jubilee Building, first floor. Anytime you can come, we will serve you. Karibuni sana.
Karibuni. Again, our social media, TikTok, Instagram, Facebook, YouTube. Mutatupata huko kote. Modern Gyno Clinic. Ask your gyno. This is us. Thank you.